It looks like we've got a pretty good group here. Welcome, everybody. I'm so glad that you jumped on and had time for this. Dosage calculation is a big part of what you do as a nurse. So it is on your NCLEX. It's on your HESI. If you're in level 2 currently, you do have a dosage calculation HESI coming up within the term. So we want to make sure you're prepped for that. So there's 3 of these this week, 3 sessions. Today's session is focusing on reconstitution of meds. So we went into that a little bit on your skills blitz day. So before I get going and start going over some details, any questions come to mind after we had that session? Is there anything in particular that you're just confused on or wondering about, or anything at all that you'd like to share? You are being recorded, so that's just so that any other students who think they don't need it tonight or can't make it, and then later on go, whoa, wait a minute, I needed that. All right, so for those of you who joined, I want to show you one more thing. So this is Student Nurse Blackboard. Let's go back. So is everybody familiar with Student Nurse Blackboard? So on there, for those of you who are LPNs or just joined the program, there's a section called calculations, medication calculations. If you open that up, I loaded in all the content that we're going to go over tonight. So here's the little video. So the folks who are in the class who went to the level 2 skills blitz, this is the same video that I played for you in class. It has some dosage calculations to practice, the answers, an infographic, an answer sheet. I don't know, that might be a duplicate. I'll have to double check that. And a reference page. So just a little more information for you, especially if you entered the program and you're trying to get caught up on everything. Knowing how to do your dosage calculations will be really important. Okay. So the first thing I want to show you, let's minimize this. I showed you that, is how to read a label. So when you're doing a dosage calculation, you may have wondered to yourself, well, how do I know how to mix it up? So let's take a look at this label together. So this is a vial that came up. I'm sure you've seen vials. If you have not, you will be seeing them in level 2 because one of the meds you get to give a lot. Level 2, level 3, I'm not quite sure where. I think it's level 2, is ceftriaxone. They often have to reconstitute it and draw it up before they administer it. This one that you see before you is for Augmentin. So you get a vial. It has a label on it. It probably has a packet insert as well. And it's powder inside there. So when you look inside, you're like, well, it's a powder. I have to administer milliliters. How do I do that? So you have to look on your label. There's a lot of things going on this label. There's barcodes, there's all kinds of stuff. So let's just start here. 125 milligrams in 5 mLs. That's great. Good piece of information, but I still have powder in my vial. How do I fix that? Well, over here are your directions for mixing. It says tap the bottle until all the powder flows freely. So I would tap it, get it all mixed up in there. Then it said to add approximately 2/3 of the total water for reconstitution. And when I read that, I was like, really? Could we not make that more clear? So it says your total volume that you're going to add to this powder is 67 mLs. Okay, so they said 2/3. I'm going to bring you back to the 2/3. But right now, I'm going to add 67 mLs to my vial, right? So wouldn't you think in your mind, well, my total volume is 67 mLs, right? It is not, because that powder takes up volume, okay? So once you put your full 67 mLs in there, your total volume, it tells you down here, when reconstituted, your total volume will be 75 mLs. Oh, that's my total. That's what you're going to do your calculations on, not this number up here. Okay, so that's really important because when you read these questions, you have to think through, well, wait a minute, is that what I'm mixing it with, or is that going to be my total end volume? Now, Your problem must tell you what your end volume is. If the problem doesn't tell you what the end volume is, we can't guess. We don't know how much volume that powder takes up for that specific drug. If it doesn't tell me, I have to go with the 67 mLs for my calculation. But they already know that. They base their answer on that, so you don't have to worry about that. But hopefully you won't see those, but we'll see. All right, so I'm going to draw up 67 mLs. And then it said to give 2/3 of that first. It's like a recipe. And I'm like, well, what's 2/3? Okay, well, it's 67. 3 times goes into 67, at least 20, right? So I'm going to put approximately 40 cc's into the vial first. And this is unusual too. It says shake vigorously. They never say shake vigorously. They say swirl gently. I'm surprised it says shake vigorously, but that's what the instructions say. And if the instructions say to shake vigorously, you are going to shake it vigorously. All right, shake vigorously. Then I put my remaining water in. So then I'm going to put whatever's left of the total of 67 into this bottle, shake it vigorously until I can't see any little bits of powder floating around in there. It's all liquid now. And after we did that, our total volume is now 75 mLs. But what I like even better is once I know I've mixed it up, is this part up here. It already told me I have 125 milligrams in every 5 ml. Okay, so for a question, you may not always get all that much information. Hopefully you have what you need to do the problem. Now down here, this is another vial. Has anyone in the group seen this type of vial before? I used to love these when I got them as a nurse. I'm like, oh, good, no mess. So this is really cool. So this is a 2-level vial. And right here in the middle is a rubber plunger. On the top is powder, and on the bottom is liquid or liquid powder, one or the other, okay? And you're going to push this plunger down. So when you push the plunger down, it pops that middle cap down and pushes whatever in the top down into the bottom. Then you just swirl it, and then you're going to draw up through the top button, which you're going to have to then clean off with alcohol because you just put your finger on it. Hopefully your finger had a glove on it. Okay, so now you have that mixed up. So that's one way. Sometimes the IV bags come with an apparatus that looks like this attached to it, and you kind of do the same thing. You're popping the plunger and shooting the powder into the IV bag. It's really nice. So then you don't have to do all this reconstitution and swapping of meds and all that stuff. Okay, do I have everybody with me so far? Any questions about the labels or where we find information? Nope, you're good. Okay, so let me just tell you, if you are nervous about speaking up or asking questions during the study sessions because it's being recorded, I'll just turn the recording off, okay? The most important thing is for the people who attended, okay, not yet, to be able to get the most out of the session as you possibly can. So you tell me if you don't want to be recorded. I don't mind at all. All right, now what I do mind is not being able to see. So let me make this big because I am old. All right. The order that we're going to do for our first problem, and I will tell you, I have not worked these problems out, so we're going to do them together, okay? Ceftriaxone, 0.45 grams is ordered. It's going to be given IM twice a day for a child with a skin infection. All right, this is the label that we got. So it's ceftriaxone 500 milligrams for IM or IV use, single-use vial. Each vial contains ceftriaxone 500 milligrams of powder. All right, they ordered 0.45 grams. I have 500 milligrams of ceftriaxone in my hand. Reconstitute with 1 ml of lidocaine. That's unusual, but it must burn when we give it. Okay, injection or sterile water, okay? But boy, if I could get my hands on lidocaine, that's what I would use. So you'd have to check with pharmacy on that one because they're going to send up what you're going to mix with. Each 1 ml of solution will contain approximately 350 milligrams of equivalent. That means the total. So each ml, once you mix it with that, it's going to have 350 milligrams. So that's now your available, okay? My available is 350 milligrams of ceftriaxone. So it's not the 500. Do you see how that's confusing? Everybody with me? All right, so I'm going to write that down here. So I have available 350 milligrams in how much? It said here 1 ml. So each ml, so that's 350 in 1 ml. So that's an important piece of information that I pulled off of there. All right, so then the order is for what? My order was to give 0.45 grams in a dose. 0.45 grams. All right, so that's my order, and that's what's available, okay? So we, just so you guys know, we are teaching dimensional analysis slightly differently now. And starting with level 1, which you've already passed through, we've instituted a whole dosage calculation work that's included in their skills class, okay? So I'm going back and forth between two styles, so please stop me if this is not how you learned it. I believe this group learned WOA, which is weight, order, and available, okay? So I'm going to stick with that. All right, so we don't need weight. Even though this is a child, there's no weight. So I can just skip that. I'm going to go right to order. I have my order and I have my available. So I'm going to do my order first. So the order is for 0.45 grams. So I'm going to put that on the top of my first fraction, okay? And it's just understood that there's a 1 under there. That's a fraction principle. If you want me to go in and explain why that's true, I will, but not here. Okay, you can just email me and we'll get together and do that on the side. All right, so now you put what was ordered and you know that grams is on top. So now all it is after this is a game of matching. Because I have grams on top, when I go down to this bottom box, it must be a gram. So now, what's in my availability? Do I have grams? No. What's it in? Milligrams? So that's a clue to you. Oh, I need a bridge, okay? Because my available is actually going to go in this third fraction, okay? So I have to have grams on the bottom here because it has to cross off with this one. So on the top is going to have to be milligrams. So this is a conversion factor. So somebody tell me how many milligrams are in a gram?
1,000.
You got it. In 1 gram. Now that's your conversion factor. Now let's put in our what's available. You got milligrams on the top. Milligrams must go on the bottom. How many milligrams? 350 in 1 ml. Now what's hard to do on the screen is to show you the crisscrosses, but let's look. See this gram matches this gram. So I would cross them out, and I want you to cross them out. When you get up to third level and they want you to show their work, you need to be able to show exactly how this looks, okay, and what you crossed out. You have milligrams here, milligrams here. I can cross them out. What remains? Milliliters. Is that what I want? Yeah, I need to know how many milliliters I'm going to draw up to administer to this child. Okay, get your calculators out. All righty. Now you are allowed to have calculators in the NCLEX and on your electronic exams. They're always in the computer. So now it's going to be 0.45 times 1,000 times 1. And that's going to equal 450. and then you multiply across the bottom. Now you can divide each of these numbers into the 450, which is easy because you've already got the 450 on your calculator, and that is technically how I do it, but I have to show it to you this way. Go away. All right, so it's 1 times 1 times 350, which is going to be 350. Okay, so now you just do the math. 450 divided by 350, and you're going to get a number that looks like this: 1.2857. Now, it's good practice to go all the way out 4 places. You don't have to. It's just going to make your work more accurate. Okay. It just helps you to know, no, I did it right. Okay. Now, in this problem, you know you set it up right because all of your units of measure crossed out and you had remaining what you wanted. So that should build your confidence. I set it up correctly. All I had to do was multiply and divide correctly. So you see, when you break it all down, very basic math. Now, you can't round until the end. All right. Now, I could go to the 10th place for this. Let's try it and see. All right, so I have an 8 to the right of the 10th place. 8 is greater than 5, so that's going to raise my 2 to a 3. Okay. So that would be 1.3. Now, my next question as a nurse, not taking a test, as a nurse is, do I have a syringe that I could measure 1.3 mLs on? If I don't, then I'm going to get a syringe that will allow me to do that because I don't really want to lose that 0.3 of med. They might need that much of the antibiotic. You know what I mean? So, it depends on what you're giving. Like for insulin, we're never going to give a point anything for insulin. It's always going to be a whole number. All right. So did everybody get that number? Does that make sense for reconstitution? What is the most confusing part of reconstitution so far? Oh, I see more chat stuff. I'll pull up the chat. Let's see. Okay. Whoa, good. Okay. Yep. Great. Okay, so you're all tracking along. Thank you. Very good. I'll move that over here. Maybe I can keep seeing what's going on in there. Okay, so everybody's with me so far. Let's scroll down. And this is the way I'm going to do it. If I'm not hitting what you need or you want something different, you just let me know. Let's read this label. All right, so our order is ceftriaxone 750 milligrams IM every 12 hours for a patient with genitourinary infection. Okay. All right, my bottle says ceftriaxone for injection 1 gram. Okay. All right, let's read our instructions. Each vial contains ceftriaxone powder to 1 gram. Reconstitute with 2.1 mLs of lidocaine or sterile water. Each ml will then have 350 milligrams equivalent, okay? So remember, I am not doing this on the 2.1, right? But here, it didn't tell me what my final dosage is, but my final volume is, I should say. I honestly don't know. If I really needed to know, I would mix it up and then measure it myself with the syringe and see how much did I get as my total final volume, which I would guess is about 2.5, but we'll see. All right, so but down here, it tells me what I've got. My available in the end is going to be how much? 350 milligrams in 1 ml. So let's write that down here. So I don't have a weight again. My order will go there when I get to it. I know what I have available. It is 350 milligrams in 1 ml. And you might have a different way. You might have to pull your order out first. Everybody's different, okay? I know my order is 750 milligrams. Okay? All right. I'm going to begin with the order. So it's 750 milligrams goes on the top. Invisible 1 on the bottom. If you know that a 1 belongs on the bottom and you don't need to do that, you don't need to worry about it. Okay, so that means milligrams must go on the bottom of the second problem, correct? Okay, I have my oh, look how nice this is going to be. I can put my availability in next. I don't have to convert anything. Love those problems. In 1 ml. Okay, so far so good. Did I use everything? I sure did. So I can take this out because I'm not going to need that. All right, 1 times 750. Did I cross milligrams crosses off with milligrams? What's left is milliliters. That's all I need. Whew. Okay, I set my problem up correctly. I'm going to end up with milliliters. All right, 1 times 750 is 750. 1 times 350 is 350. Let's do the math. Do it with me because you got to check me and make sure I get it right. 750 divided by 350. And I got a number that looks like this. 2.1428. How much? mLs. All right. So now that I've got that, I would go back to my question. I don't know if this question says it in here. Nah, I'm not going to worry about what they asked for. All right, so your instructor is going to say, round to the nearest tenth. Okay, so remember, you need to know which is the tenths and which is the hundredths. It doesn't make any sense because you got the decimal point and you got a 1 on the left, and you would think you should have a ones placed to the right, but you don't because it's math. It's a tenth. Tenth, hundredths, okay? They say round to the tenths. The number to the right is what's going to round it. This is a 4. It's less than 5. It's going to do nothing to my 1. But these 3 have to go bye-bye. All right, so my dose is going to be 2.1 ml. Did that make sense to everybody? Didn't that one kind of turn out easier than you think? When you look at all this, you're like, oh my gosh. But when you get it down to the nitty-gritty, it's not so bad. All right, let's see. Okay, next order. Clarithromycin. That's a tongue twister. Suspension, 0.25 grams every 12 hours for a patient with bacterial infection. This is important to pay attention to because when you get to the final question, it might say, how much are you going to give in a day? And you have to think and go, wait a minute, in a day? And you might write in what you put for a dose. And it didn't ask you for the dose. It asked you for the day. So you're going to have to double what you get from your problem. You got to pay attention to those little subtleties. All right. So you know your dose is 0. Your order is 0.25. So I'm going to scroll all the way down. Well, I'll squish it over here. Way over here. Order, what did I say? 0.25? 0.25 grams. Grams. I'm going to put available over here. Okay. Let's read the label. Clarithromycin, 125 milligrams per 5 ml. That's lovely. If I could get it down to 1 ml, I'd be a lot happier. Let's see what happens. All right. When mixed as directed, each teaspoonful, 5 ml, contains 125 milligrams of clarithromycin in fruit punch flavored. Okay. It's not going to get me any lower. So my available is going to be 125 in 5. Okay. All right. We begin with order, which is 0.25 grams. So if grams is on the top, grams is going to have to go on the bottom of the second one. Up, but it wants milligrams. So this is automatically going to have to be a conversion factor, okay? And it's going to need milligrams on top, which means milligrams is going to have to go on the bottom of here, which is 125. And it was 5 mLs on top. So now let's go back to that conversion factor. How am I going to get there? 1 gram equals 1,000 milligrams. All right, let's see if we set it up. As long as you have your conversion factor correct, because you memorize those, you're golden, okay? Grams, grams, cross out. Milligrams, milligrams, cross out. Remaining mLs, that's what I want. You can pause, take a deep breath. I set up my problem correctly. I am going to get the right answer as long as my fingers hit the calculator correctly. All right, so this one is going to be 0.25 times 1,000 times 5, which gives us 1,250. Okay, 1 times 1 is 1 times 125 is 125. Divide the 125 into the 1250, and you should get 10. 10 what? 10 mLs. Okay, so then you're going to draw up 10 mLs to give to your patient of that suspension. Is this making sense so far? Is this helpful? Pull up the chat and see what's going on. It's a little blurry unless it specifically says. Okay, so the full amount, they have to tell you the full amount. So they have to tell you either this piece of information, they have to tell me the final concentration. If I mix it up with what they told me to mix it up with, when mixed as directed, I would have to go get the insert for this one to see how much am I mixing in there. So if I follow the directions and put in the right amount of liquid they tell me to, I'm going to end up with 125 milligrams per 5 ml. That's what's available. So it's really great when the pharmacy does all this for us. So you may be thinking, well, how come they don't always do it for us? And how come we have all these funny powder things? It's because certain things, particularly antibiotics and steroids, aren't stable, or they won't remain stable for very long. So if you mix it in the pharmacy and you send it up and it's going to be given 12 hours later, it could have completely lost all of its potency by the time you give it. So that's not helpful when you're trying to heal a patient, right? So we have to mix it right before we give it. That's why sometimes you have to do this mixing. I'm sorry, this thing is being weird. It's actually my computer that is weird. Oh, great. I'm just going to close it. All right, let's move on. You guys did good on that one. Here's another one to read. All right, so our order is cefprozil, oral suspension. We're going to give 0.2 grams by mouth. Okay, so we know our order. It says here, I love this part when it tells me 125 milligrams is in every 5 mLs, because I know that's really what I need to know. So then I need to know, well, if I have to mix it, what do I mix it with? It says 50 mLs when reconstituted. So remember that 75 on the first one? Here it is on this one. It's telling me what my final volume is. To the pharmacist, prepare the suspension at the time of dispensing. So that means the nurse too. So the pharmacist is just going to send you that vial and say, have a happy day. So add to the bottle a total of 35 mLs of water. All right, so now see that difference again? It said to add 35 mLs of water, but that's not my final volume. 50 is going to be my final volume. And that's because 15 is in powder form now. So when I add that much water, it's going to increase that volume up to 50. Okay. I love playing around with this. Sadly, in nursing school, we don't have time to play around with too much anymore. And it was kind of fun to show the students, see the powder in there, put in this much, now how much volume is in there, and measuring it out. And then you actually got the visual on, oh, that's what's going on. But it's different for every med because you can't predict how much powder's in there. So you have to know that information, or knowing that you put whatever they told you to put in there as far as total volume, that you get this in the end, okay? So we know what's available, 125 milligrams in 5 mLs, and we know what our order is. 0.2 is our order. I'm going to put it over here again. Grams is the order. And we have 125 milligrams in, 5 mLs is the available. All right. Start with your order, 0.2 grams. Isn't it great that we use the same equation for all of it? You think, okay, reconstitution, and then we've got this, then we've got IVs. It's all the same calculation. So that makes it really nice for you guys. That's what I really love about dimensional analysis. All right, so that's in grams. So in the middle, you know this is going to have to be a bridge. It's got to be a conversion factor in the middle. I know I'm going to have grams, this computer, grams on the bottom. So milligrams is going to go on the top, which means in the next problem, milligrams has to go on the bottom. So in my availability, it's 125 milligrams in every 5 mLs. Those have to stay connected. So I put the 125 on the bottom. Ugh, hold on. Let's get our boxes straight. And 5 mLs on top. So conversion factor. In every 1 gram, I have 1,000 milligrams. Cross out gram, gram, milligram, milligram, which leaves me with 5 mLs. Okay, deep breath. You set your problem up right. All right, now all you have to do is multiply across the top, multiply across the bottom, get the calculator out. 0.2 times 1,000 times 5 gives me 1,000. I hope that's what you all got. 1 times 1 is 1, times 125 is 125. So now it's 1,000 divided by 125. And I got a lovely round 8. 8 what? 8 ml. Now, on electronic tests, they often don't allow you to put the units of measure in. Now, when I'm writing it out on my scrap paper, you better believe I'm putting all my measurements in. But then I know my final dose, after I've rounded and done everything, is the number that I'm going to enter into the box on the test. All right. Oh my gosh, you guys, we got through all the problems that I pulled out. Now, I will tell you, I think there was a glitch in my filing. I think I may have put the wrong worksheet for Reconstitution in the Skills Blitz Day math. So I'm going to go back when we're done with this session, and I'm going to re-upload the correct worksheet for you guys, because it's all Reconstitution. And I think the one I saw, I was like, that's not Reconstitution. So I'll fix it. That was my mistake, and get you the correct one. So that's kind of the end of the demo. If anybody has any anything you want to throw out as a question, anything that, let's see if I can get the chat back. I'll stop sharing. Let's see if there's anything in the chat for me. Okay, that's good. Okay, is there anything that didn't make sense that you'd like to throw out before we wrap up? I know math is an area where a lot of people get real nervous. They feel that they're not confident with it. We would encourage you to please, please, please reach out, speak up, let us know. We want to help you get over this hump, okay? It's important because, as you know, we don't always have electricity. And yeah, we've got a lot of great things out there in clinical magic land that do everything for us, which is great, as long as everything's working great. But we have to be nurses no matter what goes down. And a lot of things can go down. So you need to make sure that you have the confidence and you have the knowledge to do what needs to be done in the moment to keep our patients stable and alive. So has this been helpful to you? Please tell me, because I take feedback and I can make it different. I've got 2 more this week. Okay, good. Very good. Thank you guys. That's pretty much it that I have. If you come away from this and you think of things, don't hesitate to email me. I can make adjustments for the next um, ones that I do. Uh, we'll be doing more for level 3, and you can always reach out to Julia in the Math Center. I will post her information so that if you need some basic math help, she helps too. So that'll bring this to a close. I'll keep the recording and post it probably tomorrow sometime I'll post it under Skills Blitz and Student Nurse Blackboard. All right, I hope you guys stay warm. Have a good rest of your day.